This is Core Conversations with Natalie Baggio.
Welcome to Core Conversations. With me today is Dr. Singh. He's our new medical director of our neurointerventional program, and he's a neurointerventionalist. Welcome, Dr. Singh. Thank you for joining me today.
Thank you, Natalie. Thank you for having me here.
So you're new to, not just new to our community, but you're building and launching this brand new program for us here in Southwest Michigan. And I'm thrilled that you're going to be able to share the exciting work that you're doing and how that's impacting our community. But before we get into that, I would love for you to be able to share with the community what it's like living in Southwest Michigan and how long you've been here.
Thank you, first of all, having me. I feel really welcomed. Moving from upstate New York, the weather is not that different, but little bit more colder. I'm used to it, still getting used to it with my family. We moved here in January. The work, the so far experience has been very, very positive. I feel really welcomed here, and I'm thrilled to be part of this new program where we would be providing care to the really sick patients with stroke, the blockage kind of strokes or the hemorrhagic strokes, to provide them the advanced care locally so that we can help them regain their function back.
Well, I'm glad you and your family made that decision to relocate here and for you to practice here and build this program. I moved here myself about 8 years ago, and I have found this community to be very welcoming and invested in healthcare specifically. So I'm glad you're experiencing the same things. But what you are doing, like you just said, are life-saving procedures. And you mentioned stroke. And, we've never had this type of program here within our community. And our goal is to provide life-saving care, urgent and emergent care, where we can keep care local so patients don't have to transfer out of our neighboring communities or into a neighboring state. So these types of procedures that we're able to do, can you share what type of patient you would need this type of procedure?
Yeah, that's a very important question. The goal is to treat patient who has any kind of stroke. Stroke is one of the leading cause of disability among our patient population in the whole country. It's a very common disease. As we age, risk of stroke goes higher and higher. So what we would be providing is, first and foremost, is life-saving emergent procedure called mechanical thrombectomy. What exactly this procedure is taking the blood clot out of the blood vessels of the brain using minimally invasive technique. So what happens is there is a blood clot formed in the body that goes to the brain, blood vessels, and block the blood flow to the most important part of the body. When that blood flow gets blocked, what it limits all the nutrients as well oxygen to the brain, and it gets damaged. And during that damage, patient feel their symptoms. The goal is to bring them as soon as to the hospital and do the fast and using most modern technology to take that blood clot out with the new techniques so that we can help these patients either to save their life or to completely reverse their neurological damage.
Yeah. And the procedure that you're talking about, you have a limited amount of time, right?
Yeah.
In order to respond to this blood clot where patients can regain full function. What is that timing?
So the timing is, and any stroke is very important. As the phrase goes, time is brain. So what it literally means is, longer we take, higher the chances of permanent neurological damage that includes paralysis, loss of speech, or even death. Coma or death. Those are the realistical situations that can happen. So as soon as the symptoms are being observed by the family members or experienced by patient, the first and foremost is to call 911 so that the patient gets transferred or the family brings the loved one to the ER so we can expedite the system, expedite their care to take the clot out as soon as possible, because that is the only way we can reverse the neurological damage. So emphasis here is time is brain. Earlier you do, earlier you call for help, there is a higher probability for anybody to have their loved one to be back to normal again.
Yeah. And when someone is having a stroke, it's pretty obvious, right? You see or feel those changes, and that's the point in time where it's the time is brain, call 911, essentially.
Yes, that's right. Time is brain. How we recognize the symptoms is it's pretty simple. The acronym used by the American Heart Society as well as the American Stroke Association is B FAST. That means if B stands for if there is a loss of balance. E is I, that means any change in vision. F for facial change, that means if asymmetry in the face or one side of the face looks abnormal to the other side. Then arms, if there is weakness or numbness in the one or the other arm. Then speech, if there is slurred speech, the words are not making sense, or you are not talking normally. Your words or whatever your words are coming out, but it does not make sense what patient wants to say. And the last thing is time. The time is very, very important. So it's the most crucial thing to have. In stroke, you don't get you don't get enough time to make choices. So it is very time dependent treatment, because it is just the difference of being alive versus being independent. Longer it takes, there is a higher chances that anybody could be fully dependent, needing care in the rehab or in the nursing home. If earlier the patient comes, the probability is we can help these patients to take these clots out so that they can go to rehab. That can be done here locally, and slowly they get back to their life and be a part of their family.
Yeah. Well, thank you for sharing that and the symptoms that our community needs to be aware of, and then how to take that immediate action. But overall, in these sorts of situations, you don't have time to think about where you want to go for care. You call 911 and they take you to that nearest facility that has life-saving care like you and your team are providing us here in Southwest Michigan. And we feel very blessed for you to be here and lead this program with a team of physicians and APPs so we can serve the community and save more lives here locally.
Thank you so far for having me. Like I said, the emphasis is here is the time is brain and the teamwork. We will have 24/7 services. So it's not just during the daytime. If anybody feels symptom at the middle of the night, one of us will be available from our team who will provide the care, and we will always be available.
Yeah, thank you. That 24/7 makes a difference.
Yes, it does. Thank you.
Well, I hope you and your family continue to enjoy Southwest Michigan, and you'll be really excited to experience a lot of the summer here versus the winter, because the summers here are absolutely beautiful.
Yeah, that's what I'm hearing, and I'm looking forward to the summer. I don't know to swim, but my daughter is learning swimming, so we are excited for the summer and the upcoming one too.
Wonderful. Thank you for joining us today on Core Conversations. We will see you next week.